CGRP antibodies, syringe for migraine prophylaxis. A migraine attack can be torture for those affected. Pounding headaches, coupled with nausea and vomiting, often put life at a standstill for at least a day. If this happens several times a month, the disease becomes a constant burden. To prevent migraine attacks from occurring in the first place, researchers have developed targeted prophylaxis. Can these so-called CGRP antibodies work in migraines, and how are the syringes or pens are used? Using CGRP therapy. How does the migraine injection work? CGRP antibody therapy is primarily an option for people who regularly suffer from migraines. If this group of patients wanted to prevent migraines, they previously had to rely on drugs that were originally developed to treat other diseases. These include, for example, beta blockers, which are primarily used against high blood pressure. Syringes or pens are available for administering the migraine antibodies. How do antibodies work as drugs? Antibodies are special components of the immune system. The body forms the molecules as soon as it comes into contact with a foreign substance. This can be a pathogen, for example. The antibody has one side on which it can specifically bind to the foreign substance. This can be compared to a key that only fits in its lock. With its other side, the antibody connects to the body's own cells and thus renders the intruder harmless. Scientists take advantage of the property that antibodies are directed against a specific substance. To do this, they produce so-called monoclonal antibodies in the laboratory, which are absolutely identical and bind to a specific point. Vaccines or a drug are created that intervene in a signaling pathway of a disease and thus, for example, can prevent an attack from occurring. This is the case with the new drugs for migraines. CGRP antibodies and their effects on migraines. CGRP is the abbreviation for calcitonin gene-related peptide. It is a protein that is released from nerve cells and plays a central role in migraines. During an attack, increased CGRP values were found in people with migraines. In addition, tests have even shown that a CGRP infusion leads to migraine-like headaches in migraine patients. CGRP has a vasodilating effect and is involved in the inflammatory response in migraines. To do this, the protein binds to the CGRP receptor. There are two ways in which antibody therapy for migraine starts. The antibodies are either directed against CGRP and thus render it harmless, or they block the CGRP receptor so that CGRP itself can no longer exert its effect. In both cases, the migraine signaling pathway is interrupted. Conclusion on the migraine injection. The new drugs against migraines hold great hopes for many patients who have had to live with severe attacks for a long time, such as chronic or episodic migraines. Because even if drugs such as triptans can be used well against migraines, targeted prophylaxis of the disease has so far hardly been possible. The studies on CGRP antibodies against migraines are positive. Both effectiveness and good tolerability have been shown. Doctors describe redness at the injection site, nausea, constipation or dizziness as side effects. However, there are also patients for whom the migraine injection has no effect. The new therapeutic approaches are still a ray of hope for many patients.